Welcome to the deep dive. Today, we're tackling something really critical. What makes someone truly stand out in those super high stakes jobs, environments where, every single decision matters immensely. We're talking about healthcare. And our focus for this deep dive is a really interesting set of sources from Kaplan, the education and career folks. They've outlined common interview questions specifically for neonatal nurses. Now, I get it. You might be thinking, neonatal nursing, that's not me. But honestly, the insights here, they're gold for anyone wanting to grasp what goes into specialized, high-impact work, the core skills, the intense pressure, the dedication needed. And importantly, it's bound to sharpen up your own interview game, whatever your field is.
That's spot on. These questions, they go way beyond just checking skills. They're designed to really understand a person's commitment, their grit when things get incredibly tough, and frankly, their ethics. So for you listening in, this is a pretty unique look into the neonatal world.
It's demanding, yeah.
And hopefully you'll get some aha moments about why these roles exist and what it really takes to thrive when you're caring for the most vulnerable patients imaginable.
Exactly. So our mission today, let's unpack these 6 key questions. We'll look at the kinds of answers Kaplan suggests are expected and really dig into what they reveal about the candidate and ultimately about the care those tiny patients receive. Let's dive in. Okay, first question. This one feels foundational, like it gets right to the core. What inspired you to become a neonatal nurse? Seems simple on the surface, maybe?
Simple question, but the answer tells you a lot. It's really probing for genuine passion, that deep-down motivation you absolutely need for this kind of work. The source points out that a strong answer often mentions wanting to make a positive impact on the lives of some of the most vulnerable patients. That makes sense, but what's really interesting, I think, is it's not just about, I love babies or I want to help. Kaplan says the best answers also show they're drawn to the fast-paced and challenging nature of neonatal care. It shows they get it. It's demanding. You need to learn constantly, adapt quickly. It takes real emotional strength, not just a caring instinct.
Right. And what stands out there for you listening is that just liking something isn't enough, is it? Especially in tough roles. Real drive often comes from knowing which specific challenges pull you in. It's not just vague helping, it's understanding the particular struggles you feel equipped for or driven to tackle. So when someone shows both sides caring for the vulnerable and embracing the challenge, does that seal the deal on passion? Or are there still, subtleties?
That's a good question. It definitely signals a better informed passion, I'd say. The nuance might come from the specifics they share. Was it a personal experience? Something they saw? A deep interest from their studies? The best candidates connect that passion to a realistic understanding of the job.
Okay, that makes sense. So from the why, the motivation, let's move to the how. Question 2 gets practical. Can you describe a difficult situation you have faced in your previous experience as a neonatal nurse and how you handled it?
Yeah, this is where they need to show, not just tell. The source really emphasizes describing specific actions, clear thinking, and crucially, staying calm. So things like remaining calm and composed even when it's chaotic, detailing how they were monitoring vital signs, administering medications accurately, and a big one, communicating with the baby's parents.
That communication piece feels huge.
It is. And the example Kaplan gives, a premature baby born with a serious infection, really drives home the stakes. The ideal answer shows collaboration, working closely with the baby's doctors and other members of the healthcare team for quick, effective treatment. And again, providing that essential support and information to the baby's parents. It's problem solving under immense pressure.
Wow, yeah, that example is intense. And for you, the listener, the big takeaway here is showing how you solve problems, not just saying you did. It's about demonstrating that composure, that clear communication when emotions are running high, and that ability to work seamlessly with a team during a crisis. These are skills valuable absolutely anywhere, right? Not just in medicine, it's the how that matters. Okay, given how fast medicine changes, it's logical the next question is about learning. How do you stay current with the latest developments and advancements in neonatal care? Lifelong learning feels essential everywhere now, but maybe especially here.
Oh, absolutely essential. In healthcare, staying current directly impacts patient outcomes. It's not optional. And the source outlines a really proactive approach, not just one thing, but several, like regularly reading relevant medical journals to stay on top of research, also attending continuing education courses, going to conferences, and other professional development opportunities, basically actively seeking out new knowledge and skills. And another point mentioned is being part of something like a Neonatal Nurses Association, that networking. Learning from peers, it's invaluable. It shows they're engaged with their professional community.
That's a great picture of building your own sort of knowledge engine. It's not passive. For you, the lesson is clear. Continuous learning and networking are vital in any specialized field. You can't just rely on your initial training. You've got to actively keep growing, keep adapting, and build that habit of seeking out knowledge. Don't just wait for it. Otherwise, well, you risk falling behind. All right, let's talk about the environment itself. The NICU, the Neonatal Intensive Care Unit, is known for being incredibly intense. So question 4 tackles this head on. How do you handle stress and pressure in the neonatal intensive care unit? You need solid coping skills, right?
Definitely. This question gets at self-awareness and whether someone can perform sustainably. Burnout is a real risk. The source describes a mix of strategies. Some are practical, job-focused, staying organized, prioritizing tasks, and taking breaks when needed. Simple stuff, but crucial to manage the workload. It also stresses communicating effectively with colleagues and, importantly, asking for help. Recognize that you need support isn't weakness, it's smart teamwork, especially there.
Yeah, that asking for help bit is key.
And then there's the personal side. The source mentions self-care, like yoga, meditation, and exercise. It's about recognizing you need to recharge to keep going, especially with such emotionally heavy work. It's a whole-person approach.
That's such a vital point about resilience, and it applies everywhere. It's not just about pushing through, it's about working in a way you can sustain, protecting your own well-being. For you, the insight is that self-care isn't a luxury. It's actually fundamental to performing well consistently in demanding jobs. You have to build that resilience to avoid burnout. It's like maintaining your own foundations.
Okay, question 5, take a broader look. How do you ensure that the infants under your care receive the best possible care? What does best possible really encompass in this context? Right, this goes beyond just doing tasks. It's asking about their overall philosophy of care, their commitment to quality and safety. The answer, based on the source, pulls together several threads. First, staying up to date on the latest research and best practices, that knowledge foundation we talked about. Then it's about process. Following the guidelines and protocols established by my facility. Adherence to standards is critical for safety. And teamwork, again, working closely with the rest of the healthcare team. Care is collaborative. Plus, that vital link, good communication with the parents and providing them with regular updates.
Sounds like a whole system.
Exactly. It's multi-layered. Science, protocols, teamwork, and that human connection with the family. It's a complete ecosystem ensuring the best care from every angle.
So best possible isn't just the medical side. It's this active mix of knowledge, rules, collaboration, and empathy. For you, the takeaway is that quality in any service role isn't just one thing. It's how all these pieces, expertise, standards, teamwork, communication fit together. It really shows that technical skill alone isn't enough. You need that compassionate element too. And that leads us to the final question, number 6, which really highlights the nurse's role as a champion. Can you describe a time when you had to advocate for a patient in the NICU? This feels like it's about going the extra mile.
It really does. This question probes their ability to think critically, act ethically, and be decisive when a patient needs more. And the source gives a really compelling example. Imagine a premature baby was born with a rare condition that required specialized care that was not available at our facility. What do? The strong answer describes taking initiative, working with the baby's parents and the rest of the healthcare team to push for what's needed. Specifically, advocating for the baby to be transferred to a different hospital that can provide the care. It involved complex steps. Communicating effectively with the doctors and nurses at the other hospital, managing the logistics, and critically making sure the parents were informed and involved in the process every step of the way. It's about fighting for the patient beyond the usual boundaries.
Wow. That's a powerful example of taking charge when the system wasn't quite enough. For you listening, this shows incredible empathy, right? But also sharp problem solving, looking beyond immediate limitations. It demonstrates how powerful advocacy can be, the real insight. Leadership isn't always about a title. Often it's about having the courage to speak up, challenge things, gather resources, and be a voice for someone who can't speak for themselves. That's a lesson with broad application. Now, beyond these specific questions, the Kaplan sources also mention some other tools, things aimed at helping job seekers more generally, not just for the interview itself.
Yeah, that's an interesting point. While the focus is on the Q&A, they also touch on resources like an interview coach. It's described as something to transform your interview performance. So help with presentation, communication skills. Then there's an offer analyzer tool. This helps you compare your job offer and compensation package against market rates. That's pretty useful for knowing your worth. They also mention career guides for strategic planning, helping empower and shape your professional future. And things like a job seeker account for getting your resume seen, connecting with employers. So it points to a broader ecosystem of support beyond just prepping for questions. These kinds of tools can offer a real strategic edge in the job market today.
Absolutely. And that really underlines the message, doesn't it? That full preparation, using all the resources you can find, can give you that unwavering confidence, help you make your mark, as they say. It's not just about the interview answers, it's the whole package, the whole approach to your career, whatever path you're on. Well, that was quite a deep dive. Unpacking these neonatal nurse interview questions has been genuinely insightful. It's so clear that this work requires this incredible mix, sharp medical skills, huge emotional intelligence, and just this unwavering commitment. To the job, yes, but mostly to those tiny patients and their families.
It really is extraordinary. And maybe, for you listening, the question to mull over is this: how does understanding the depth behind these questions, the human qualities they're searching for, change how you see the care happening in these critical settings?
Yeah.
Or perhaps, how might it inspire you to tackle your own professional challenges with maybe a renewed sense of purpose or empathy or just better preparation?
Definitely something to think about. Thank you so much for joining us on this deep dive. Keep exploring, keep questioning, and keep discovering the knowledge that's all around you.